And then moving on to the other sections of the report, there is, for this Tempest report, a section called Tumor Normal Matched Analysis. We don't often use this in lung cancer because in this section, it's really comparing the tumor um, molecular profile to a normal tissue like blood, just to look for any hereditary mutations or genes that can be passed down from parents to children. But I mention it here because it does show up on the report. As far as the pertinent negatives go, that's another section that shows up on the report. And what this is reporting on any clinically relevant genes in lung cancer that are negative. Remember that pie chart that I had showed earlier, where there's a whole number of molecular alterations that can be found in lung cancer and have associated therapies. Well, it's also important to exclude those alterations to make sure that they're not present as well. The other section of the report is immunotherapy markers. Here, what the report shows is a tumor mutation burden, which is the number of mutations in the DNA of tumor cells, as well as microsatellite instability status, which indicates the ability of it indicates the ability to repair mistakes in DNA. While there's a lot of information on the report, I think that, as far as the details of it, I think it's important to review it with your medical oncologist to really determine what information is important and useful in determining treatment options. Because for medical oncologists who are treating lung cancers, we're primarily focused on the genomic variants part of this report. The immunotherapy markers like tumor mutation burden and microinstability status don't have as big of a role in us deciding treatment options as the genomic variants do. The other part of the report that I think is also important to highlight is this FDA-approved therapy section. And what you can see in this report is that this is a list of the approved therapies based on this patient's molecular profile. So here it's listing a number of EGFR targeted agents, and here on the left side, it's describing the mechanism or how that drug works. But what I want to caution is that, even though here on the report, it lists a number of therapies like afatinib, dacotinib, osimertinib as FDA-approved therapies for the EGFR mutation, this is only listed in alphabetical order. It is not meant to be listed in any kind of preferred order of treatment. So, in practice, we're using a lot of osimertinib for our patients with the common EGFR mutation. So, again, very important to go over this information with your medical oncologist to determine which therapy is appropriate. Just because they're listed here does not mean that every treatment is equal in efficacy and side effects. So that's why it's important to, review the report with your doctor. And then even for the FDA-approved therapies, there's different levels and categories of evidence here based on the National Cancer Guidelines, as well as the MSK OncoKB here that's listed on the report. But basically what it's, what that level of evidence or category of evidence is telling us is, what is the FDA approved status of the drug, and what is the level of evidence that we have for that specific therapy. So generally, level 1, category 1 drugs have the highest level of data for those drugs, whereas for level or category 4 drugs have the least amount of data or evidence for that drug. And that goes for the levels for the OncoKB consensus as well as the NCCN categories for the different drugs that are available.